Welcome to part 2 of chapter 72. We're going to start with the metabolic and nutritional disorders, and those are on pages 1211 to 1212. The first one we're going to talk about is marasmus, which describes a general failure to thrive condition. It's often caused by a general systematic disease, an absorption problem, neglect, abuse, and symptoms are wasting and atrophy of body tissues. And then we have, of course, I always love to say this one, kwashiorkor, which is a protein deficiency, rickets, which is a vitamin D deficiency, and scurvy, which is a vitamin C deficiency. So for nursing, what we want to do is restoration of hydration and nutrition, maintain their body temps, provide general tender loving care, and teach the caregivers about nutrition and general aspects of child care, such as feeding routines, hygiene, affection, and play. Biliary atresia is a defect in the bile ducts. It prevents bile from escaping from the liver. Lack of bile causes defective digestion and elimination, and treatment is surgery, and they may require a liver transplant. Celiac disease is malabsorption syndrome in children of European descent. It is a chronic intestinal disorder. It involves small bowel inflammation and nutrient malabsorption. They question whether it's congenital. They have an intolerance of gluten. It is characterized by large floating fatty stools, anorexia, undernutrition, and failure to thrive. As nurses, we want to educate the caregivers to read labels carefully. To treat it, we're going to do a gluten-free diet. Phenylketonuria. Phenylketonuria is a hereditary metabolic disorder. Untreated, it can cause severe mental retardation. It is an absence of the liver enzyme phenylalanine hydroxylase, and phenylalanine is not converted to tyrosine, and phenylketones build up in the blood and tissues, causing permanent brain damage. So for children with PKU, they are most often blue-eyed, blonde, with sensitive skin, related to melanin not being formed. How they test is they do a blood test, they do a heel stick after the infant has consumed breast milk or formula for at least 2 days, and then the test is repeated at 2 weeks. It is usually required by law in most states. And remember, existing damage is irreversible, so we want to treat it before any further damage is done. How they treat it, they do a diet low in phenylalanine, which is an essential amino acid. You want to avoid bread, milk, eggs, meat, cheese, legumes, nuts, and some artificial sweeteners. They can eat low-protein natural foods such as fruits, vegetables, and certain cereals. And as nurses, we want to educate those caregivers on the importance of reading labels. Disorders of the eye, we have strabismus. That is squint or cross-eyed, usually congenital. If it's found after 6 weeks, you want to have an evaluation done. They treat it with an eye patch, surgery, or corrective glasses. As nurses, we need to speak to a child before touching, especially if their eyes are covered, to avoid frightening them. Congenital glaucoma is an increase in intraocular pressure with symptoms of an enlarged edematous and hazy cornea, and increased hearing, pain, and photophobia. Surgery may be necessary. Cataracts may be present at birth, or can occur because of eye trauma or disease. Pupils appear to be white and they treat it with surgery. Amblyopia, 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 lazy eye, subnormal vision in one eye, and they usually treat it with an eye patch. Know what the definition of amblyopia is. Cytosis is drooping eyelids. It's usually congenital and they treat it with surgery. The most important thing if they're going to have, if a child's going to have surgery, we need to remember to teach the caregivers pre and post-op care. So we need to provide education to the caregivers for pre and post-op care. Diseases of the ears, nose, throat, and mouth. Wow, I could talk today. Otitis media is an acute infection of the middle ear. It's most common bacterial infection of early childhood. Acute, they have a rapid onset. Subacute lasts between 3 weeks and 3 months, or they may have chronic, which lasts greater than 3 months and may result in hearing loss. Medical surgical treatment, and they can also do antihistamines, decongestants, Tylenol, antibiotics, or they may place tubes to allow drainage of accumulated fluid, and you want to avoid getting water in the ears. So with children who have had ear tubes, you want to make sure that you avoid them swimming or, taking a shower, or be very careful shampooing their hair. You can get special earplugs because you have to avoid getting water in their ear. Epistaxis is a nosebleed. Cause can be from foreign objects, trauma, allergy, systemic disorders. If a child has a nosebleed and a head injury, do not stop the bleeding without health care orders. Because if you do, holding the blood inside the nasal cavity can increase intracranial pressure. Tonsillitis is inflammation of the tonsils caused by a virus or bacteria. Treatment is antibiotics if it's bacterial, symptomatic if it's viral. If it's reoccurring, they may do surgical treatment. With children with tonsillitis, you want to observe or if they've had their tonsils removed, you want to observe for them spitting up sputum, bloody sputum, or vomiting. You do not want to give them red juices and frozen pops. Pre and post-op teaching, they're NPO after midnight. Post-op, you want to encourage fluids, soft foods. Do not let them drink through straws. And you also want to provide pain medications and signs and symptoms of post-op hemorrhage. You want to watch for those. You want to watch for any types of respiratory distress or an increased temperature. Cleft lip and cleft palate. Cleft lip is more common in boys. A cleft palate is more common in girls. There are deformities that commonly occur together at birth. They can do a cheiloplasty, which is a surgical repair of the cleft lip, and they can do a platoplasty, which is a surgical repair of a cleft palate. The surgical treatment, the goal of surgical treatment is to restore function and improve the child's appearance and restore normal speech. With children who have had these surgeries, you want to apply elbow restraints to keep them from rubbing the suture lines. With children who have had surgery for a cleft lip or cleft palate or both, you want to apply elbow restraints to keep the child from rubbing the suture lines. When you feed them, you want to feed them slowly. Give them small amounts, hold them upright, use special nipples, dilute solids and spoon feed them, and prevent aspiration. In some cases, they may need gavage feeding. You want to provide consistent dental care, and you want to clean their mouth and cleft carefully after each feeding. And you want to protect them against getting any colds or upper respiratory infections. Baby bottle syndrome is bottle feeding, which is bottle feeding that continues after child has teeth. You never want to prop a bottle because it can result in dental caries. So we have to be sensitive to the family's feelings, especially with children with cleft lip and cleft palates. And post-op, the most important things we want to do, we need to maintain that airway. We want to prevent shock or hemorrhage. We want to prevent any injury to the suture line. So we are going to apply elbow restraints to keep the child from rubbing at the suture line. And we always want to make sure that we use proper feeding techniques. Cardiovascular disorders. Septal defect. You have your ventricular septal defect, or VSD. That is the most frequent congenital anomaly of circulatory system. It is an abnormal opening between the left and right ventricles, and the treatment for ventricular septal defects is open heart surgery. Arterial septal defects is an opening between the left and right atrium. It occurs in the area of the foramen ovale. If valves are involved, the surgery becomes more complicated because they will need valve replacement. Patent ductus arteriosus, or PDA. Ductus arteriosus remains open after birth. The blood vessel between the aorta and the pulmonary artery, allowing fetal circulation to bypass lungs, and this may cause pulmonary hypertension. Then we have transposition of the great arteries. That is where the aorta and the pulmonary artery are reversed, so each connects to the wrong side of the heart. They need to have immediate intervention. If no shunt or septal immediate intervention, they need to have immediate intervention. So because the reason is it is connected to the aorta and the pulmonary artery are connected to the wrong side of the heart, and the child dies early related to lack of sufficient oxygenation. Tetralogy of Fallot, or TOF. It is a combination of 4 major defects. It is pulmonary stenosis, ventricular septal defects, overriding aorta, and right ventricular hypertrophy. An infant with severe defect in any of these areas are cyanotic, and they need reconstructive surgery. Stenosis. Pulmonary stenosis is narrowing of the right ventricular outflow tract, including valves. It decreases the flow into the lungs. And aortic stenosis is an aortic valve malfunction, which causes the heart to work harder to pump blood to the body. Coarctation of the aorta. The aorta narrows, obstructing blood flow. It's similar to aortic stenosis, except that it's further from the heart, and it causes circulation problems in the arms, head, and lower extremities. Blood pressure will be higher in the upper extremities than the lower, and the pulses will also be stronger in the upper extremities than the lower. And they treat that medically or surgically. And tricuspid atresia is an absence of an opening between the right atrium and the right ventricle. There is no blood flow from the right atrium to the right ventricle, greatly decreasing pulmonary blood flow, and the child dies soon after birth unless corrective surgery is performed, and a child is cyanotic. And of course, open heart surgery is bypassing the heart circulation by means of heart-lung pump, and the heart is temporarily stopped. Blood and lymph disorders. Kawasaki disease is a febrile multi-system disorder resulting in inflammation of blood vessels. It occurs in children younger than 5 years of age. If untreated, 25% of children develop severe cardiac problems. Causes are unknown. It's highest in Asian people. Symptoms are prolonged fever of 5 days or more, red infected eyes, a strawberry tongue, edema of hands and feet, reddened and peeling soles and palms, a rash in the perineal area, swollen lymph nodes, pain. We have to provide supportive treatment, performs frequent oral and skin care, and make sure they're on continuous cardiac monitoring. Anemia is an abnormally low number of RBCs, or red blood cells, low hemoglobin content, or defects in RBC functioning. It can result from hemorrhage, a hemolytic disease, malabsorption of vitamin B12, or it may be related to hereditary factors. Iron deficiency anemia is the most common childhood type of anemia. So what should be the first solid food that we introduce to infants? It should be iron-fortified cereal. Sickle cell disease is a genetic disorder. They will have misshapen RBCs that are ineffective as O2 carriers, causing anemia. Sickle cell trait, it occurs in the person with one defective gene and one normal gene. Sickle cell crisis is severe, painful episodes of sickle cell anemia, and it's caused by clumping and occlusion of blood vessels. So nursing, for nursing, we need to, if they're in a sickle cell crisis, we need to make sure that we provide pain management, O2, and rest. And then we also want to educate the caregivers to avoid cold climates and high altitudes. We also want to educate the caregivers to avoid cold climates or environments and high altitudes. Idiopathic thrombocytopenia purpura. It is most common acquired bleeding disorder of childhood, seen in children 3 to 7 years, seldom sorry about that. It's the most common acquired bleeding disorder of childhood. It is seen in children 3 to 7, and it's seldom fatal in children. The greatest risk is intracranial hemorrhage, but the cause of the disease cannot be identified, although an affected mother can transmit it to her fetus. Rectal temperatures or enemas are not recommended because of the possibility of trauma to the mucous membranes. You want to avoid urinary catheterization. And to treat it, it would be platelets, steroids, and in extreme cases, they would do a splenectomy. Hemophilia is a gender-linked hereditary bleeding disorder. in which a deficiency exists in one or more of the factors necessary for blood clotting. So we need to teach families to recognize symptoms of bleeding, to get medical assistance immediately when needed, and to protect the child from injury without being too overprotective. Most generally, you will see they're missing that factor. Usually it's factor 8 or factor 9. Males become symptomatic with hemophilia, whereas females are carriers of the gene but are rarely symptomatic. So nursing, you want to prevent, like I said, prevent the injuries without being overprotective. And, just educate the caregivers on symptoms of bleeding and to get medical assistance immediately. Blood and lymph disorders continued. We have leukemia. There are 4 different types. We have acute lymphoid leukemia, acute myeloid leukemia, chronic lymphoid leukemia, and chronic myeloid leukemia. Leukemia is malignancies in bone marrow and lymphatic systems, and you will increased rates in children less than 4. Acute lymphoid leukemia, or ALL, is the most common kind of cancer in children less than 15, and they have a better prognosis. ALL, or acute lymphoid leukemia, is the most common kind of cancer in children under age 15. Acute myeloid leukemia is most prevalent in adults. It's rarely seen in children. Acute lymphoid leukemia and chronic myeloid leukemia progresses slower. Factors that affect the survival rate are early diagnosis, age of the child, and individual success of therapy. How do they treat it? Chemotherapy, platelet therapy, radiation, combination of chemotherapy and radiation, hematopoietic stem cell transplant. Children with leukemia, we want to prevent infections and injury, provide emotional support for the families. Do not take rectal temps. Always report a cough or symptoms of an upper respiratory infection immediately. Hodgkin's lymphoma, lymphosarcoma, and other sarcomas. Hodgkin's lymphoma originates in lymphocytes. Lymphosarcoma is a group of blood cancers that develop from lymphocytes. And then there are other types of sarcomas. Most common cancers in children are brain cancer, kidney, adrenal glands, bones, and structures of the CNS. These usually are not Hodgkin's lymphoma, lymphosarcoma, and other sarcomas they're not uncommon in children, but they usually have a poor prognosis as malignancies progress quickly and are not detected early. Respiratory tract disorders. Upper respiratory tract is common in children and adults caused by bacteria or virus. Symptoms is fever. They may have swelling in the throat. They may have tenacious sputum and mucus. And how do we treat it? With antibiotics, rest, and O2 if needed. Pneumonia is an inflammation of the lungs. We treat it with antibiotics, bed rest, fluid. It may be the initial infectious disease, or it could be secondary to another disease. Laryngotracheobronchitis. Laryngotracheobronchitis It is also known as croup. It is a viral infection of upper airways. It usually follows an upper respiratory infection. One of the symptoms is a barky cough. They may have inspiratory stridor, hoarseness, and how do we treat it? With cool, humidified air and keep them calm. Epiglottis. Epiglottitis is an acute, rapid, progressive, life-threatening inflammation of the epiglottis. It is usually caused by bacteria. The cardinal symptoms of this are severe respiratory distress, a high fever, absence of cough, and drooling of saliva. And you do not want to examine the throat or obtain a throat culture because that may cause respiratory obstruction. Asthma is a chronic inflammatory disorder of the airways. It causes airway obstruction. It affects millions. Attacks can occur abruptly or gradually. Symptoms are wheezing, chest tightness, difficulty breathing, and they usually treat it with inhalers and steroids. Status asthmaticus is an acute severe asthma, and status asthmaticus can be fatal. Bronchiolitis is a viral respiratory infection. It results in the inflammation of the bronchioles. It tends to be seasonal. RSV is related to more than half of the cases of bronchiolitis. It's most often seen in children under 2, and you can usually treat it with IV fluids and O2. Cystic fibrosis is a multi-system chronic lifelong condition. Major dysfunction of the exocrine glands. Most common genetic disease in Caucasians. Symptoms, they'll have a hard, non-productive cough, frequent respiratory infections. They'll have a barrel chest, finger clubbing, signs of malnutrition. So how they diagnose it is family history. They will have increased sodium chloride levels. They'll have a history of frequent respiratory infections, failure to thrive, and duodenal secretions for trypsin. If they do if the sweat test is positive, only one other criteria must be met for a positive diagnosis. How do they treat it? Massive antibiotics, high calorie, high protein, moderate fat diet, water-soluble vitamins A, D, E, and K because of poor fat digestion, chest PT, and inhalation therapy. Teaching, we need to teach the caregivers about chest PT, chest percussion, postural drainage. Also, they may need some IV meds. And what we have to remember too is they may need extra salt in summer months. Gastrointestinal disorders, pyloric stenosis, congenital hypertrophic pyloric stenosis. That's where the pyloric sphincter thickens, narrowing the canal through which food passes from the stomach to the intestines. It's more common in boys. If obstruction is complete, you will see projectile vomiting. How do we treat it medically? We may give antispasmodic drugs, thickened feedings. Surgical treatment is they will do a pyloromyotomy, which is an incision in the wall of the pylorus. After surgery, you want to take precautions to prevent aspiration. You want to position them on their right side with their head elevated slightly. Meckel diverticulum is a congenital disorder in which a small portion of the ileum ends in a blind pouch just before its junction with the colon. Symptoms of this one is bloody, tarry stools. They can have hernias, which is a protrusion of part of an organ through an abnormal opening. They can have a diaphragmatic hernia, which occurs rarely, where a portion of the intestine protrudes through the diaphragm. It's diagnosed at birth and they repair it with surgery. Umbilical hernia is a portion of the intestines protrude through a weak umbilical ring. Indirect inguinal hernia is most frequent in boys. Intestines protrude through the round ligament into the inguinal area and may descend into the scrotal sac. Direct inguinal hernia, it protrudes through the weakest part of the abdominal wall. It can cause severe hemorrhage, peritonitis, generalized septicemia, or strangulation of the hernia if the hernia ruptures. Diarrhea can be caused by pathogens in the GI tract. Sudden increase in frequency of loose watery stools. Severe diarrhea can be rapidly fatal in an infant. We can treat it with Pedialyte. You want to avoid salty broth. IV fluids. You want to maintain accurate I's and O's and provide good skin care. Encoparesis is incontinence of feces. Treatment for this is geared towards improving family relationships and understanding personality patterns. You can treat it with increased dietary fibers, and fluids are recommended. Lactose intolerance. Inherited disorder characterized by an inability to metabolize lactose in milk and milk products. Yogurt is an excellent source of calcium. Remember, yogurt is an excellent source of calcium. And the presence of lactose can also interfere with absorption of other foods. So just remember, yogurt is an excellent source of calcium. Megacolon, Hirschsprung's disease. Symptoms and diagnosis. The colon lacks the parasympathetic nerve supply. Newborns fail to pass meconium 24 to 48 hours after birth. Their abdomen becomes enlarged with stool and flatus. Medical, they can do saline enemas, stool softener, and digital removal, or they can do corrective surgery, but that may be delayed until the child is 1, and it often involves a temporary colostomy. So as nurses, we need to watch for abdominal distension, temperature spikes, irritability, especially after surgery. And then we also have to observe for signs of a possible anastomotic leaks. And so we do have to make sure that we watch for possible anastomotic leaks. And what is colic? Colic is a paroxysmal abdominal pain, most common in the first 3 months of life. It's not serious, but it can be frustrating. So we want to encourage the family to develop support systems. Urinary system disorders. Enuresis is involuntary passage of urine, usually at night. Hemolytic uremic syndrome, it is an acute condition. 3 conditions occur with this. It is renal failure, hemolytic anemia, and thrombocytopenia. Hemolytic uremic syndrome is a leading cause of acute kidney failure in children. Hemolytic uremic syndrome is a leading cause of acute kidney failure in children. Urinary obstruction, or they can get urinary tract infections. Pyelonephritis. Pyelonephritis is a potentially dangerous infection of the upper urinary tract and kidneys. And then glomerulonephritis is the most common form of nephritis. You'll usually see it in children 5 to 10. It usually results from an immunologic reaction to an infection elsewhere in the body. The main symptom of this is smoky urine or hematuria. Nephrotic syndrome is changes in the basement membrane of the glomeruli, which causes the kidney to excrete massive amounts of protein. Wilms tumor is a malignant adenosarcoma. It is most common in children 3 to 4 years of age, and it usually only affects one kidney. And then hypospadias is the meatus is on the underside of the penis. Epispadias, the meatus is located on the top of the penis. And usually, just back to Wilms tumor, in most cases with the Wilms tumor, the child shows no symptom until the tumor has advanced. So, treatment for that depends on the extent of the disease spread. They may do surgical removal and irradiation of the tumor site in both sides of the spine, and they often also use chemotherapy. Ambiguous genitalia they exhibit genitalia that seem to have both male and female characteristics. They perform studies immediately. They study the buccal mucosa or skin structure microscopically for female or male chromosomal pattern. A hermaphrodite is a child that has both testes and ovaries and results in male-formed external genitalia. Cryptorchidism is an undescended testicle. And hydrocele is an accumulation of serous fluid within the scrotal sac, and that is, a hydrocele is often associated with hernias. And then nutritional considerations in young children. Introduction of solid foods. Signs of readiness include they ingest at least 32 ounces of milk daily without hunger satisfaction. The disappearance of the extrusion reflex. The doubling of birth weight. The ability to sit unsupported and lean forward with an open mouth to receive food, or lean back and turn head away, thereby indicating fullness. That is the end of chapter 72. Next week on Monday, you will have a quiz over chapters 10 and 72, which will be on Socrative. When we meet on Thursday for our Zoom, I will go over and review chapter 10 and 70. So I hope you can join us on Thursday at 11. Have a great week.